The following presentation is a production of Ride the Wave Media.
It's the Best Birth Podcast, where we interview experts that elevate you as you prepare your heart and mind to have the best birth.
Each episode will interview professionals so you are prepared for pregnancy, birth, and postpartum. Our experts will build your confidence and empower you to trust your intuition throughout your pregnancy.
This audio is taken from videos on YouTube. Watch the entire episodes on YouTube at Birth Made Mindful. You're listening to the Best Birth Podcast. Our guest today is Calie Hong, a postpartum doula.
Calie has been a postpartum doula for almost 2 years. She has always loved babies and has been a nanny in the past. She has become very passionate about mental health and education as it relates to pregnancy and birth. She is also passionate about supporting new parents as they transition into their new roles. Welcome, Calie.
Thank you so much for having me.
Well, Calie, just give us a little bit of a background. What led you to become a doula?
Yeah, so I started to find interest in being a doula and supporting parents after my own mental health challenges. I ended up being in the ER and not knowing what my rights were, and it was a very scary time. And I had my mom with me, and she was great, but she also didn't know how to advocate for me. And that resulted in a lot of treatment trauma. And as I've talked to many of my friends who have had babies, I realize there's so much hurt in the medical system because people don't know what their rights are. So that really is why I've decided to do labors, because that is something that I feel like people need to have an advocate, and they need information. Information is so much power.
That's so beautiful. I don't think I even knew the term birth advocacy until my second son. I was hoping to have a VBAC, and that's when that terminology was kind of a little bit more prevalent. When you are helping parents to prepare and get into the right mindset so that they can have their wishes granted, what are some tools that you give them?
Some tools I give them is you have different options of having your baby. You can go natural, you can choose to have an epidural, and you can choose to be induced or not to be induced, and all of those are your choices unless it comes into an emergency situation. And you also can birth in, like, at home. You can be at a hospital or a birthing center. There's so many options, and I encourage my parents to do research for what feels right for them.
That's so great. The premise of our podcast is to find the best birth, whatever that looks like for individuals. The main way we can come to these preferences is usually through spelling it out with a birth plan. I remember with my first son, the doctor asked me, let's put together a birth plan. And I feel like she asked me about 2 questions. Do I want skin to skin after? And do I want an epidural? And that was pretty much all I knew at that time. And so as I've learned more about pregnancy and birth and the types of options that there are, I'm able to guide and find my preferences. Do you often walk parents through a birth plan, or is that something they have prior to coming to you?
Most of my parents do not have a birth plan when they come to me. Most parents have no idea about anything. Most of them are still looking for providers. They're still deciding where to deliver and who to deliver with. So I give recommendations, and it's pretty across the board, a little bit of everything, and I let parents feel what is right for them, and then we come back and make a birth plan. Like, what are your absolutes? Like, I want this in my birth. I absolutely don't want this. So something that is very common right now is like delayed cord clamping. And there's doctors that feel inconvenienced by that sometimes. And there's a lot of power to delayed cord clamping. And that's just one thing that I'm like, you know what? We can make that happen if that is like really important to you. And just like, you have the option to say, hey, I want to keep my placenta, or I absolutely do not want to be induced. Like, you get to say that. And so I have my parents decide what are their like absolutes must-haves, and we go from there. And then we start to develop a plan that is going to feel good for them. And my big thing too is like, you can change your mind at any point. You might have said, hey, I want to have a natural birth, we're not having an epidural. And we get there and you have an epidural. Great. Like, you are allowed to change your mind at any time.
That's the key to birth, right? Creating a plan and then being able to go with the flow when the plan isn't happening the way that you plan. I want to touch back a little bit about the birth education. So you said a lot of parents come to you and they don't really know what they want. There's so much great information out there. There's some information that's not going to apply to you in your situation.
Absolutely.
Right? So a lot of times we have to realize that we have individual needs, we have individual health concerns, and creating a plan, creating a vision for your birth has to take all of those into consideration. When I was having my first baby, the hot topic then was like an episiotomy, right? People saying, well, do you want an episiotomy? I didn't even know what that was. I realized after researching a little bit that I did not want that. But there are times when that can be medically beneficial.
Absolutely.
There are times when an episiotomy can mean that you're avoiding a C-section. And so I think it's important to take all of our interventions, to learn about them, and then to be able to access them as we need them in our birth.
Yes.
And that's why a birth plan is such a cool thing, because as you're researching, you get to find a lot of different options, things you may never have considered. Wearing your own clothing.
Yes, absolutely.
Instead of wearing a hospital gown, you can elect to wear your own clothing. Some people say, well, I definitely don't want to wear my own clothing because I don't want any amniotic fluid on it.
Right.
I don't want any blood on it. I just want to wear the hospital gown. And so the power in choices is what we want to instill into our parents.
Yes.
Can you give us some examples in creating a birth plan that you've seen that are successful?
Absolutely. So one thing that I think is really successful in a birth plan is both partners, if applicable, are involved in this. I think if there are two people that are in the birth room, everyone needs to be on board. And I think it needs to feel right to both of them, not only just the birthing parent, but also the supporting person. One thing that my clients really enjoy in a birth plan is knowing their options beforehand, like you said, and then knowing why things have to happen if they have to happen in an emergency situation. So I always have my clients lay out, like, if you can make one wish and your labor goes exactly how you want it to be, what does that look like? And that is what we'll aim for. Whether that's like, I want an epidural and I want to be induced, sure, that's great. Let's go that route. And if you don't want that, let's try another route. But I always have it planned out before and give my clients the option to change at any point. And we start making a birth plan as soon as they're ready. Like, this is not something that needs to be made 2 nights before. Like, let's start talking about it once you're 12 weeks. So you have the time to do the research.
This is so powerful, beginning with the end in mind. How have you seen a difference in patients that have these birth plans and then the outcomes after birth?
There's a huge difference. It's night and day comparison. Typically, labors are shorter if you have a birth plan. A lot of times, when there's not a birth plan, there's a lot more fear because they don't know what's going to happen, and they kind of just let the nurses and doctors do whatever they say and don't know that they can have a voice. With a birth plan, it makes a huge difference knowing what is going to happen and what you want, and it's something that you should take to your care provider and say, hey, this is my birth plan, and you take it to every appointment, and you remind them, like, this is what I want. And it also is so important that your provider is going to respect that. And if you feel like your provider is not going to respect that, it might be time to find a new provider. But that's why I would highly recommend making it from the very beginning, because you'll know, like, if your provider will support you or not.
Yeah, creating this birth team, creating the support that you want in your birth so that you feel honored and respected and heard. All of these things will create greater satisfaction. And it's not about a badge of honor in one way of birthing or another. It's not about getting credit for a certain number of hours or just minutes in pushing. All of these things are going to vary birth to birth, mother to mother. Even a 4th-time mother may have a 20-hour labor, and that's not something that she should feel defeated by. But I think researching, taking it from the very beginning, creating a vision, having some element of control, even maybe manifesting the birth that you want so that it can come to pass.
Absolutely.
Right? You can't build something that you have never thought of. You can't create an event that is just then happening to you. A lot of hospitals will have policies. Each person that comes through the door will receive the interventions or the IV as per their policies, unless a person says, for this specific reason, I'm going to decline.
Yeah.
And it's always an option. You can sign paperwork if you want to decline an IV, or if you want to say, hey, I know that it's been recommended that I am not ready for an epidural, but I want that epidural now.
Absolutely.
Right? My sister-in-law, she got the epidural right when she got to the hospital, and that was her wish, was to have that right away, even though she wasn't progressed in her dilation yet.
And important too, just to have these potential outcomes or backup plans or scenarios that you've visualized or understood could happen, and then being better equipped to handle them once they do occur, if they do occur. The more options that we're aware of, the more we can tailor it to our unique choices. Are there some other preferences that you've seen that people have had, whether it's playing music or having certain people in the room? What other elements of a birth plan have you seen?
Yeah, I think a really common one is to have like a meditative playlist. I know people have brought in like lights and had it darker and just made it a more like homey, safe feeling, and that is something that seems to be common. A lot of times they go back and forth, like, do we want mom in the room? Do we not? And that's something we can talk about and think about throughout the time. And if you need help having that conversation with your mom, I will help you have that conversation with your mom if you don't want her to be in there. And just, you get to decide.
And in advocating for those desires, once you've spelled them out, what role do other people play in helping you advocate for your desires?
One thing is you might be able to advocate for yourself when you're not in the middle of birth. For sure. There's so much emotions and it's so different. So I think it's really important to have your partner be supportive and know your birth plan and your wishes so they are able to support you and be a voice for you. And it's emotional and hard for them too. So that's why I would highly recommend hiring someone like a doula who can come in and do that for you and remind the doctors, hey, like, I don't want to be checked every hour. I just want to trust my body and know when I need to start pushing and know where I'm at, and have someone that can say that for you if you cannot say that in the moment.
We can link in the show notes some great websites that talk about patient advocacy. What are your rights? What are the questions that you can ask if you are feeling like your rights aren't being honored? And then, heaven forbid, if things need to escalate further, even trying to document an experience in birth. So you say, I'm going to take this moment now to document that my wishes are not being granted.
Yes.
Making sure that you just know you have those rights. You also have the right to ask for a different provider in the moment.
Yes, you do.
And that's an important thing to realize. If there's a nurse who is just not jiving well with you, if there's an on-call doctor who, is not respecting your wishes, you can ask for somebody else. And it might feel really emotionally charged in the moment. When you spoke about emotions, it's like bringing back to my memory, like all of those emotions.
Yeah.
But it's your right and it's your birth. And I think it's important to recognize that you don't have to be rude, you don't have to be mean, but you can be direct and you can make your wishes known. You can also say no, or you can say, I would like to enact the informed consent, and mind you that I do not consent. And a lot of times those words can have a lot of power in our birth. I want to talk to you a little bit about the moments right after birth, these treasured, precious moments when the baby is born. How can your doula help you to create these moments?
I think the biggest thing the doula can do is they are able to help you through these hard moments, and then you can also have a plan after baby comes. I want to have skin to skin. I want to have cord clamping delay. And a lot of times nurses and doctors, they might feel like they need to do things right away, like check baby and take baby to the warmer or whatever. But if your wish is to have skin to skin, that is absolutely an option.
And your body can warm them?
Yes, your body will warm them better than a warmer.
With these parents postpartum, I know that that's more your specialty, your area of, expertise. What led you to the postpartum side of things? Why was that a draw?
Postpartum has always kind of been something, I've always liked the newborn phase, but I also have realized there's not a lot of education out there. I have parents all the time who are like, I've never even changed a diaper. And I'm like, no big deal. Like, let's teach you. Don't be scared of it. It's okay. Or, how do I feed my baby? What happens if I cannot breastfeed? Then what does formula feeding look like? And just the very basics of like, when should my baby sleep? Is it okay that my baby's sleeping 22 hours out of 24? I'm like, yes, they're brand new. It's okay. So there's just things, and I want parents to know that they have a safe place to ask any question. There are no dumb questions. Ask me anything, and I will help you find what feels right for you.
If I had a dime for all of the dumb questions that I asked, I would be so rich.
We all would.
Learning how to do all of those baby care items right after birth, that just takes time. And so having that doula that can come in and say, you're okay. It's okay that you don't know any of these things, and working together with the partnership, making sure that everybody feels really confident so that they can move forward and give that to their baby as well. I think a baby recognizes when their parents feel confident or when their parents feel doubt.
Absolutely. They can absolutely feel your emotions, and when you can have a regulated nervous system, your baby can have a regulated nervous system.
Do you have any tips or tricks for these new moms that you find, okay, this is a question I'm getting all the time?
Yes. The question I get all the time is like, we are not sleeping, we are tired, now what? And I offer my service as overnight support. So that looks like coming into your home about 9 or 10 p.m. and staying until about 6 or 7 a.m. And during this time, my goal is for parents to get as much sleep as they can get. And I will take care of all of the baby's needs throughout the night, and also help mom if she needs help washing pump parts throughout the night or whatever that may look like. And so sleep is the number one tip I have for parents. Like, that's the only thing I can promise you every parent needs. You all need sleep. There's nothing else that is universal.
I love that there are resources for that gap when we are heading into postpartum, and just like you said, the sleep. We talked to another postpartum doula, and she mentioned too that she is there sometimes, just doing postpartum work separate from her doula work, because those can't really coexist if you're up in the night and then trying to help another woman with labor. But for parents that maybe don't have access to a doula, are there any things that you have to recommend for resources or support in those cases?
Yes, I think asking for help is hard, but people actually want to help you. Mm-hmm. So if you are able to just say, hey, I didn't sleep great last night, can you come for a couple hours and just hold my baby while I sleep? I don't think very many people will tell you no. And I think you just have to realize it takes a village to raise this baby. And I know hiring support is not an option for everyone, and that's okay. There's other ways to do it. One thing I always tell my clients to do the nights they don't have me there is to split the night in half. So one parent sleep in the room with baby for 4 hours, and the other parent sleeps in their own bed for 4 hours. So everyone at least gets 4 hours of uninterrupted sleep a night. And I have seen a huge difference with that. And people ask me all the time, well, what about if we're nursing or things like that? Totally fine. Take baby into mom as needed. But then when it's your shift, take baby back, burp them, change their diaper, put them back down, and let mom just go right back to sleep. But it's not exhausting just for the mom. It's exhausting for both people involved. So I think it's really important to remember you kind of have to share the load.
So true. Well, every week we share a Mom Squad secret. This week's secret comes from Cassie, and she says, I highly recommend listening to birth podcasts. I learned a lot. Interventions are also needed in labor, choosing a provider you trust and who is supportive of your goals. And that goes right along with what we were talking about today, getting that education, getting that support, choosing the provider that will support your birth plan.
Absolutely.
Calie, do you have any resources that you'd like to share with our listeners?
Yes, I do. There are tons of online resources that a lot of them can be free, like a mental health therapist, or there's support groups. There's support groups all over. There's tons that are different, like knowing your birth plan or hypnobirthing or breastfeeding support, and just having somewhere to go with people who are in the same stage as you. So that is my number one suggestion, is find local in-person support if you can, because birth and postpartum can be lonely.
Thank you so much, Calie. This conversation has been so beneficial. We appreciate you being on the podcast today.
Thank you so much for having me.
Thanks for joining us on today's episode. We hope you've been elevated and inspired by this week's expert.
Subscribe today so you never miss an episode. And please share our podcast or post on your social media so that other moms and dads-to-be can also have the best birth.
Please note that the information provided is based on the expert's insights and personal experience. It is not intended as medical guidance. Please seek the advice of your medical provider as it applies to your specific condition.